Good afternoon. I'm Ted Shortliff. I'm chair of the National Academies ad hoc committee on implications of discarded weight-based drugs. I'd like to welcome everyone on behalf of the National Academies of Sciences, Engineering, and Medicine to this virtual public session. This is the committee's third public session, and there are video recordings of the first two that are available and posted on the project's website, which is www.nas.edu/drug file size. You see it here on this slide. We have a wonderful committee working on this interesting problem, and I'd like to recognize my fellow committee members, Julie Donahue, Anupam Jina, Tracy Liu, Gary Lyman, Kavita Patel, Harold Paz, Deborah Schrag, who's going to be co-hosting this afternoon session with me as a moderator for the speakers, Tina Shi, Ken Silverman, Holly Taylor, Jonathan Watanabe, Alastair Wood, and Robin Yabroff. I'd also like to thank the study staff that have been extremely hardworking and helpful in putting together everything we've done to date. Cheryl Nass, who's director of the board on healthcare services, our study director, Francis Amakwa, Tracy Lustig, Ali Andrada, and Annalie Gonzalez. The study sponsor is the Centers for Medicare and Medicaid Services, U.S. federal government. So here's our task. That's what we've been working on. Current delivery practices, including manufacturing, storage, and transportation guidelines, and the guidance from relevant federal agencies to biopharmaceutical manufacturers and distributors. These are all part of what we've been asked to analyze federal drug reimbursement and cost sharing policies and implications of the current dosing practice to patient safety and quality of care and financial consequences of these drugs when they are discarded. So we're going to issue a report with findings and recommendations to consider in order to reduce waste in this biopharmaceutical supply chain area. And you can find more information about the committee, the details of the members, its task, and the meeting materials. They're all posted on that same website, drug vial size, all one word. So I'd like to remind everyone that this is an information gathering session. That is, we're still in the process of assembling materials. We're going to examine those materials and discuss further in the course of making our findings and conclusions and our recommendations. So I need to ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions. It would be a mistake for anyone to leave here today thinking otherwise, or drawing too many inferences from comments you may hear, comments that are made by individuals, including those who are members of the committee, should not be interpreted as positions of the committee or the National Academies. And in addition, committee members may ask probing questions that may not be even indicative of their own personal views. The committee is going to deliberate thoroughly before it writes its draft report. And once the draft is written, it has to go through a rigorous review by experts who are anonymous to the committee. We will not know who they are. Committee then has to respond to the review with appropriate revisions. So it's a rigorous process. And we have to be sure we adequately satisfy the Academy's report review committee and the NAS president before it's considered an official Academy's report. In addition, I want to note that this is an open on-the-record session. Anybody could have signed up to attend this session online. Certain interested individuals and members of the press have been invited to attend as observers, but this is not a news conference. That will come at the very end. Reporters who'd like to talk with members of the committee are kindly asked to touch base with the study director, Francis Amakwa, or the media officer at the National Academy's Office of News and Public Affairs and Public Information, Stephanie Muselli. If there's something you want to be sure is brought to the attention of the committee that you may not hear discussed today, for example, or you think needed to be discussed in more detail, then we welcome written input and suggested resources. If you have something of that sort you'd like to say, please email them to drugvialsize@nas.edu, and they will be responded to, those messages. We intend to have this report ready early next year. And we thank you for dialing in and joining us today for this conversation, which we expect to be the last of our public sessions. And I'm going to turn things over to one of our other committee members, Dr. Deborah Schrag, to introduce our panel for this afternoon and to moderate that panel. Thank you.
So just to recap, the goals of this public session are to discuss the Medicare Part B drug payment system and to explore measures to reduce waste from single-dose vials and their associated costs in our very complicated biopharmaceutical chain. The goal is to examine the impact of potential revisions to current policies and practices and think about how we may mitigate waste with respect to physician-administered drugs, and how we really achieve the goal of high value in our healthcare system. And to help us with this, we have assembled some really thoughtful leaders to help us tackle this issue and to help the panel deliberate on these issues. We've asked each speaker to address us for about 20 minutes with a presentation. They have slides, and that will be followed by a Q&A session at the end of each presentation. And you're encouraged to use the Zoom function to raise your hand, and Dr. Shortliff will acknowledge you.